my name is Dr. Barawi. I'm one of the doctors working here at San Marcos Family Medicine, and we are out of our Ideal Wellness Shop where we're working on having patients improve their health by working on their weight loss and achieving healthier lifestyles. One of the options we offer here is weight loss by using medications such as semaglutide or tirzepatide, which are once a week injectable medications to help with weight loss. I'm going to start by showing you what goes in your medicine pack and how to draw up your medicine and use it appropriately. And now I'm going to show you what's in your bag. You will notice on the bag it says refrigerate. That's because the medicine belongs in the refrigerator. It is okay to travel with it, but I would not recommend leaving it in a hot car or overnight in any locations that are over about 65 to 70 degrees. And so if we pull out everything that's in our little bag, we'll recognize all the parts that we need to make sure that we draw up the medicine appropriately and safely. So we'll put our bag to the side. Inside your bag, you will have 5 syringes. These are insulin syringes, so they do have a cap and a safety on them, which help with being able to draw up your medicine. 5 syringes. Even though there are 4 doses in each vial. One is an extra syringe in case a needle bends or you drop one of the syringes. That way you have an extra in case you need anything. Here we have our alcohol swabs. One is going to be used for the top of the vial when you're cleaning it off to draw the medicine up, and the other one will be used to clean the area on your abdomen where you're going to inject. And then this is our medicine. So you'll see that it has instructions on it, and each vial has how many units you will be drawing up. Each vial is made to order, so it will have your first and last name on there, and so it'll be important to pay attention to how many units you'll be drawing up on the insulin syringe. Now, it will tell you how many milligrams, but again, the most important thing is how many units on the insulin syringe. Now I'll be opening up our box that has our vial and pull out the actual medication. So you will see that the medication has a hard cap and there is fluid inside. Now it won't look like a whole lot of medicine, but this should last you 4 weeks. There is a hard cap that comes off. You will never need this again. As I mentioned before, you will be cleaning off the top of the vial to make sure that it's ready for use without introducing any dangerous bacteria and that it's sanitary for drawing up. That is clean now. And then we'll familiarize ourselves with the syringe. Now, depending on the dose you're on, your syringe may go up to 50 units or 100 units. In this case, this syringe goes up to 100 units. The orange cap is where the needle is. When you pull the orange cap off, you will find that that is a very small gauge needle. When you push this bottom plastic part up, that is the safety, and it encloses the needle so it doesn't hurt anyone. You can set it down safely and clean the area on your abdomen, making sure that you don't have any issues with the syringe. The other thing is the plunger. I would familiarize yourself with it, make sure it's moving well. That way you don't have any air bubbles or issues when you're trying to draw up the medication. So pulling down the safety and recapping, and that is your insulin syringe. Now, what I would recommend is using the alcohol swab to clean the area on your abdomen. You want to go about 2 inches below the belly button and then about 2 to 3 inches to the right or to the left. You can inject the same area every week because it's about a week apart. You're not going to cause any harm from injecting in the same space. You are also welcome to alternate sides, so do the right 1 week and then the left 1 week. And so I'm not going to be exposing my abdomen to show you where to inject, but if you have any questions on how to do that, we will have some pictures at the end that may be helpful. Biggest side effects to anticipate will be nausea, usually within the first 24 to 48 hours, and constipation. And so those can be combated by different ways. Usually when I give these injections, I tend to wait until the early evening or before bedtime because that way you will be able to sleep through some of the side effects that you would have from the medication. As far as constipation, I have a handout that may be helpful to review as far as going through and managing those symptoms. And so if you have any questions, everything is on our little handout, and we can review that together if you have any additional concerns. We also have a troubleshooting card for our ideal wellness, and this is useful if you have any frequently asked questions or concerns, or want to figure out how to get more supplies or how to contact your provider. As far as the medication, now that I've loaded up the syringe, I'm going to put the medicine back into its little box and close it up. I'm going to get rid of these extra supplies. As far as discarding these needles, you are welcome to buy a sharps box to help make sure that you're disposing of them correctly. Otherwise, if you want to collect them and bring them into your provider, we are able to dispose of those for you. Moving forward, I would also recommend, if you have any additional concerns, always asking your provider. After injection, if you are having any severe reactions, including shortness of breath, significant nausea, vomiting, or feeling generally unwell, I would recommend going directly to the emergency department. Now, these things are rare, but I would definitely recommend going in there and also contacting your provider.
Remove your medication from the box. Remove the protective cap from the vial. Wipe the top of the vial with an alcohol swab. Take a syringe and pull back the plunger to fill it with the amount of air equal to the prescribed dose of medication. Insert the needle into the vial through the rubber top. Push the air into the vial to make drawing up the medication easier. Turn the vial upside down with the needle still inside, ensuring the needle tip is submerged in the liquid. Slowly pull back the plunger to draw up the exact amount of medication. Gently tap the syringe to bring any air bubbles to the top. Push the plunger slightly to expel the air bubbles without losing medication. Wipe the injection area with an alcohol swab. Pinch a small section of your skin, insert the needle at a 90-degree angle, and slowly push the plunger in to inject the medication.